Why would we expect anything different now? And there is also another crisis that is looming under Obamacare as millions of newly insured patients enter the system. States are seeing a major expansion of Medicaid. But its low reimbursement rate means a serious shortage of doctors and nurses, and that's likely to get worse. Steve Moore is a senior economics writer for the Wall Street Journal. You know, one state trumpeted how many people they had signed up for Obamacare. Turns out something like 90% of them were simply signed up for an expansion of Medicaid.
That's right.
Which sort of defeats the whole purpose of Obamacare. Talk to us about that.
Well, Greg, you're exactly right. What's happening now is that almost all of the people who are getting Obamacare now are being pushed into the Medicaid system, and anyone who is familiar with that knows it's a kind of welfare program. It's one of the worst healthcare delivery systems, not just in the country, but in the world. Much different than Medicare, which seniors really approve of. And so you're not going to get the kind of quality of care under Medicaid that you would get under a private plan or Medicare or just about any other kind of plan that you can conceive of. You put your finger on it, Greg. There's long lines. A lot of doctors don't take Medicaid because the reimbursements are so low. Big problems for people who think they're going to get quality health care that are being pushed into Medicaid.
Yeah, I was actually talking recently to a couple of doctors, and I asked them, do you take Medicaid patients? And they both, shook their heads and said, I can't. I lose money on Medicaid patients.
That's right. That's right, Greg. It's ironic, but it's more expensive now to get a plumber than to get to see a doctor under Medicaid. And you're talking about doctors who rack up hundreds of thousands of dollars of debt to get their MD degree, and then sometimes the reimbursement levels are as low as $40 or $50 to see a patient.
Right.
So they're not. You put your finger on it, Greg. They're actually losing money to see Medicaid patients. Anybody who's running a business knows you can't stay in business very long if you're actually losing money the more patients you see.
And both Medicare and Medicaid are headed toward insolvency. Mm-hmm. Is that why the reimbursement rates are so bad, or what's the real reason?
What happens is that Congress is always trying to save money in the healthcare system, right? Because, as you said, both programs are going bankrupt. And instead of kind of structurally changing the way the programs work, what they do is keep putting the squeeze on not just doctors, Greg, but also hospitals. A lot of, for example, Mayo Clinic doesn't take Medicaid patients any longer. And so, if you really want quality of care, the last kind of insurance system that you want right now is Medicaid. And it is ironic that that's the only kind of system that most people can get under under the computer systems that people are supposed to be going on this weekend. Can I make one other point about something that was said? James Rosen said, we said now we're going to have 50,000 people that could be on the exchanges at the same time, and I'm scratching my head thinking, my goodness, we're in an era where we have YouTube and Facebook, and they take millions of people at one time. 50,000 is minuscule.
And the White House thinks that's a great thing. Wow, 50,000 people all at the same time without crashing. That's really great. No, it's pretty awful and embarrassing and really disgusting.
Maybe they should have had the Google people or the Facebook people put the computer system in place. It would be working a lot better right now.
Exactly. Look. There are 48 million Americans roughly right now who are uninsured. After all is said and done, $2.6 trillion of taxpayer money spent. The nonpartisan Congressional Budget Office says in 10 years there's still going to be 31 million Americans who are uninsured. So all of this to reduce uninsured from 48 to 31 million. And, of course, nowhere near the president's promise that he was going to make sure that every American is insured.
Yeah, and Greg, the reason this story is important to people watching is that there is a big difference between having health insurance and having quality care. And yes, people are going to be insured under Obamacare, but if all these people are being pushed into Medicaid, they're not going to get the high quality of care that Americans demand.
Not only that, but, states after the first, 3 years are going to have to
start paying for it.
Yeah, they start paying for it. And they can't afford it,
Yeah,
All right.
That's the way Washington works. Push the cost onto somebody else, the doctors, the hospitals, the states, anybody.
You got it. Steve Moore, good to see you, Steve. Thanks so much.
You too.
All right.
Have a great weekend.
You too.